Hey, I want you to check out the conversation that I had with Kylie Amanda. She's a registered dietitian. We talked about how important it is for you to be taking in the right foods for healing after your cosmetic procedure, your plastic surgery, to help avoid issues like lipoburn and open incisions. We talked about different ways to supplement. Please check out the conversation. Drop your comments and questions below. And make sure that you give Kylie a follow over on Instagram. She's nutrition.plasticsurgery on IG. And she's got a free guide to the best proteins to be taking for your cosmetic surgery procedure. Go ahead and reach out to her. She does some consulting work for pre-op and post-op, especially if you're having a complication or you're worried about it. And if you're having any wound issues, please reach out to me directly. You can drop me a picture or comment or whatever below, or reach out at betterwounds.com. Thanks.
Hey everybody, I'm Heather Flexer with Better Wounds. I hope you're joining us live. I invited Kylie Amanda, registered dietitian, to join us. So I'm just gonna wait for her to get on. I haven't done an Instagram. I have. I'm trying to get better at it. So yeah, I'll post this there once I download it and get it over there. And I'll tag you and do all the good stuff.
I need to be on YouTube. It's really where, your information can last. And I feel like that's where I need to be, but that's a
You
whole
can
different
You do
ball.
so many videos, so I'm sure you've got a stockpile of them somewhere. And if you just download and upload, and you'll have a page.
I need to do that.
So hi, thanks for joining me. Um, if people don't know who you are, can you give yourself a little intro?
Yeah. So my name is Kylie Amanda, and I'm a plastic surgery dietitian. I worked in over a decade in Massachusetts as a post-surgical dietitian, and then I transferred all of that into the private sector, where I just really saw a enormous gap in nutrition education in the plastic surgery segment. And I also am friends with surgeons, and I also have several of my friends who had bad experiences. And so I started privately a few years ago to help women have a better recovery using nutrition, because that's what I saw in the hospitals. I saw the difference of nutrition for healing. And so now that's what I do. So now I have a protocol called the Better Body Protocol, and it's a coaching program that takes women through the surgery process, and I make sure that you have a better experience and you heal safer. Using nutrition lowers your risks by 30 up to 37%. So, oh, hello, Dr. Connor. She's fantastic. So that, um, so yeah, so that's what I get to do, and I absolutely love it. It's fantastic.
It's super important. I mean, I think obviously your experience and being in hospitals and healthcare facilities, dietitians are normally involved in, the wound care for patients. But like you see, and I see in this kind of space where people are being sent home to recover, it's like the wild, wild west.
It is
So, yeah. And I mean, they're hearing, I asked them questions ahead of time. We're hearing like a couple of similar questions. People always hear the recommendations like more protein and more water. And then it kind of ends after that. Maybe they've heard to use Juven. So that was like one of the questions that we definitely got
yeah.
was, do you recommend Juven? What's your thoughts on that?
Well, first I'll do protein and water, and they're all very valid. You know, I I come alongside the surgeon, right? So the surgeon does not have time to do a thorough nutrition education. So protein and water is fantastic. What I see people doing a few things. Number one is they become deficient in micronutrients. And that just means that they're getting their macros, and
So you mean like proteins and carbs?
they're
Okay.
very carbs. They're mostly getting their fat and their protein, but then they're missing all the micronutrients. And the micronutrients is what your skin and what your wound healing needs in order to heal. Those micronutrients are like, like your B vitamins, right? Even your vitamin C's. I mean, just like vitamin E, vitamin A. I mean, just like all the vitamins that I have in some of my posts. We're missing out on those because we're just doing like a very high protein with water. What I've also been seeing, what I've noticed, and this has just been in my practice, is that their gut health is horrible because um because of because they're just not having any, they don't have any fiber, they don't have any produce. Your produce, like your fruits and vegetables, are the ones that help your gut. And so my patients who are coming to me, they have major gas and bloating, and they're not pooping and all that. And that
Yeah.
that is something that you have to address before surgery, because number one, your gut's going to get a ton of antibiotics, and it's going to go through the ringer after surgery. But you want your gut in the best possible position before surgery. And so that's what I work with as well. So that's kind of my take on the protein and water, is that if you do that, it's not bad advice. But what happens is that you become deficient in other nutrients besides protein and water, and your gut function is just very subpar because you're not getting any other nutrients. And so those are the two things.
So that made me think of how people are having swelling issues that are, perseverating past, normal surgical stuff. Could that be part of it? Is that their guts not working?
I think it's honestly, when I see people who are swelling too long afterwards, um, it's really everything. It's not their guts not working. It's just it's not working well. They could have like some overgrowth in there that's not working well. But really, at the gist of it is, if they're swelling too much, sometimes it's just that pre-op was just not there. That's that's what I've seen, and I know
So
that
how early do you like to work with people?
it really. I like to work with people more, starting more than 3 weeks. So I really like to see you about 2 months before. Initially, I wanted people to start with me 2 months before and then a month after. But humbly speaking, they weren't really needing me like, you know, more than 3 weeks after surgery, even more than 2 weeks. So I've kind of just said, listen, let's just start a little bit earlier and let's get you as much on the front end. And I've just noticed a huge difference. If I get you on your front end, after that, I don't really see you much on the back end of the surgery. Um,
I
but
mean,
that's what
that's
I've noticed.
great. Isn't that like everybody's goal is to go in, like you go in, you smooth sailing, like you don't need wound, advice for me. Like, yeah.
I really need to learn how to brag on myself, but yeah, I mean, I just haven't seen it. But even if it's swelling, I'll go back to that because I do want to address if because currently, you're like, I can't do anything about it if I didn't really prep too much. But the swelling is really a few things that I like to say is number one is you definitely have to increase your water. You have to increase your potassium foods. So your citrus, any kind of citrus, your oranges, even like your lemons, pineapples, any of your citrus foods. Those are going to be two things. And then I really like to recommend ginger and turmeric in a natural form, not in a supplement form, but a natural form. There's studies behind ginger a lot. There's a lot of studies behind turmeric as well. I like that as a natural way to help with your swelling. The bromelain, um, you know, uh, I mean, bromelain pills, I haven't really seen a huge
Well,
difference.
that's like your pineapple tea you're talking about,
Yeah,
right? That's right. Yeah.
yeah. I think realistically, I think if you get a really good brand of bromelain, I think you're going to get enough bromelain. I think that in general, when I see people boil pineapple skins and I see people, you know, do all the stuff with the pineapple, I mean, I think it's great because they're getting hydration, they're getting vitamin C, they're getting fiber. So I still promote it. I think for bromelain, for swelling, I just think you just need to take, the pill for it. I don't think it's gonna there's really not a lot of evidence that's going to be that much in the rind or anything like that.
Okay.
But for swelling, that's what I do. High potassium foods, all high potassium foods, because the high potassium foods, they're also like an electrolyte, right? So it kind of helps
Hmm.
out that water, in the interstitial fluid, and then also the water in general, and also um, uh, ginger and turmeric in the natural.
Okay. And what did you think about Juven?
Yeah. So, so I saw your email. So it's great. I love working with you, by the way. So here's kind of what my take on it, because I got your email and I sat and kind of like thought about it, and then I thought, okay, here is my official answer. So when it comes to wounds, it's like you have to. I mean, not you, but I approach it as an um. I don't. It's different when it comes to wounds. It's like
Yeah.
this is your medicine, and if you don't like it, we need to figure out ways that you need to like it. We need to figure out ways how you're going to take this, because to be perfectly honest, from a dietitian point of view, there's really not anything else on the market like Jubin. It's been around for 20 years. I mean, I think I've
Hmm.
been in the hospital for years,
Oh, yeah.
and anything um there's not anything like it, really. And what I think, the example that you sent me, it honestly.
Oh, so eye center, sometimes I'll make a recommendation for it's more of like a workout supplement that happens to have branched chain amino acids and nitric oxide and stuff like that. So that's what we're talking about.
And that, and actually, that's really not bad. That's really not bad. But what I noticed when I looked at the label, and this is why sometimes the labels on supplements are just so deceptive, it was like very little of the amino acids that you want for wound healing. And so
Okay.
it looks like a lot, right? Like you pulled up that label and you're like, wow, I'm getting a lot. But what you really want um, is what Juven has. And so unflavored Juven, if you can mask it in anything, peanut butter and bananas can almost mask any flavor. If you can mask it in anything, I say, this is like your medicine. I know it's not great. I know you don't like it, but let's find a way that you can take it for 2 weeks, because this is the HNB in Juven, the arginine, levels of arginine in Juven. It's the research all back up.
And that would be like the recommendation, not necessarily for everybody recovering from plastic surgery. This is like if you actually have a complication, like if your incision has opened up, if you have lipoburn, if you have something else going on. But if your like healing is kind of going along smooth, you maybe don't need to take it forever.
And I'm so glad that, because in the hospitals, when we gave Juven, it was a last ditch effort. Like it was like, we have done this, and this, and then we'll have Juven, right? So it was more of the things of, you can't rely on Juven to heal you, because you really need all the other things before that. Juven's going to come along and be great if you have a problem with the wound, like a non-healing, like lipoburn, things like that. That was when I would say, okay, have you done A, B, and C? Okay, now we bring in Juven, right?
Yep.
That,
Okay. And then just, I don't know if a couple of questions popped up in here, but like Wound Bite and Heal Fast are two of the like supplements that a lot of people take. I just saw some questions.
yeah,
Do you have any thoughts on them?
ew. But what is the nice way to say it? You know, I just there's a few supplements that I like to recommend. Those two are not them. That's how I
Okay.
say it. That's how.
Yep. So people can reach out to you and get on your program and yeah.
More of like I've been kind of familiar with those supplements. I know I've been very familiar with Heal Fast, And I just how do I put it? I just there's just a few things. There's just if it's directly on Amazon, number one, I get a little hesitant about it. If it's only been sold on Amazon and that's all it's been sold. In it when I read it and have been reading about it, it looks like it was started by anesthesiologist. Um,
Mhm.
and that was the one thing. And so but like I think your better bet, honestly, I think your better bet besides those is to go to a health food store and go into a real health food store and say, what is your absolute best multivitamin that does not have herbs, herbs or anything like that. That would be one of the better, I think, solutions than doing something like Heal Fast. Or what was it
Okay.
that,
We'll invite.
yeah. I mean, that's kind of my take on those supplements. I know they're big and I know lots of people
Yeah.
take, you know, and they're not harmful. They're not harmful. I just say if that was me, that's not something that, I would take. That's kind of how
Someone said, why no herbs?
doctors don't want to do before surgery.
After surgery.
Yeah. Oh, I mean, after surgery, it should be okay. But, I like to say if before surgery, you just continue taking it after surgery. So I just recommend a supplement that doesn't have any herbs in it.
I
Because
gotcha. Okay.
then they'll make you stop it before surgery.
Good. Good point. So check your labels, ladies.
Yeah.
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 Um, so blah 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 blah. Does any of these things would the recommendations change nutrition wise if they're have an active infection?
Yes. So here's kind of I just did I did a little diagram for you, Heather.
Oh boy.
Okay. So, this is like surgery recovery normally. So, if you have a surgery recovery, this is food. This is supplements. And then after that, if you have any infection, then yeah. And this is supposed to be my other one with the lipo burn. But then this is where you get all the specialized nutrition if you have something like an infection, inflammation, lipo burn. With an infection, my biggest concern are two things. My biggest concern is fluids and not just water, but I want my clients to have like water with nutrients in it just because your calories are going to increase because of infection. You said infection, right? Infection.
Yeah. Yep.
Your calories are going to increase because of infection. And
Because your
so,
body is like needing to burn off more to fight the infection.
yeah,
Okay.
a lot more water. So that's my biggest concern with infection is I'm like, okay, you already need a ton of water after surgery. How are we going to get more water? But that's when I say, if you have an infection, um, even if it's, excuse me, even if it's like a diluted Pedialyte, or you have your electrolyte waters, or even just really getting in those water rich produce, lots of your berries, lots of your cucumbers. You want as much water as possible. So that's the one thing, is that if I give you, like a fluid recommendation, if you have an infection, I even make you even do more. It's almost more important for me to give you more water than anything else. The second thing, making
Does it
sure
also help like flush your system too? Like help get, yeah.
everything. Yeah. Um, and then the second thing is making sure if you have an infection and you have antibiotics, making sure that we're protecting your gut during this time.
That's the
Um,
last thing you need is the
mhm.
runs and a faja.
That's how, like, that's all you need is like post surgery, you've got diarrhea, right? Like that's
Yeah.
so that those
It's not, I just got an image.
awful. Those are my two biggest concerns. And of course, you want more calories and all that, but from a nutrition standpoint, it's almost hard to even get more calories in a client who is post-op surgery
Yeah.
and so realistically, it's like I could give you a number that's higher, but realistically you're not going to be able to reach it because you've got all these things going on. But to me, the most thing, gut health and fluids, big thing.
Yep. And someone asked about probiotics, but yeah, that's essentially what we're talking about
Yeah, definitely.
with, yeah, especially if you're on antibiotics.
Yeah, and I say start early, get it in early, and start. If you're pre-op, start it as early as possible, and just keep taking it.
Okay. Yeah, especially in those early days. Now, someone had a question about salt intake, and I'm sure a lot of people are trying to lower the salt to lower the amount of swelling.
Hmm.
But are you supposed to have no salt?
No, because I allow salt in my post-op clients. It's really just about education. It's really about knowledge. It's really about having a meal plan that how much sodium is in your diet. So that's um I think that's the one thing. If you struggle, like you need that salt, first, I say try to change your taste a little bit before surgery, because the last thing you want is have to change everything after surgery and everything tastes terrible because you've had to go salt free. But I like to recommend three things if you don't like salt. Number one is spice can replace salt. So, so I'm from New Mexico. And so if I want spice, I add green chilies. And I don't if I'm adding green chilies for spice, I don't have to put in that much salt because the spice, the heat, the hotness is kind of overtaking like the salt craving. So adding a spice to it, depending upon your culture, what's hot for you, red pepper flakes, for me, green chilies, things like that. That'd be the first thing. Number two is, even if people roll their eyeballs, Mrs. Dash has 30 different flavors now. I mean, she's got 30 different flavors. She's got taco seasoning and Cajun. And I mean, there's like 30 different types of seasoning. So don't just do the original, buy that whole set, fork out the money. You can get like 18 bottles on Amazon for like $40. Before surgery, just buy it. It's so worth it. And that way you'll have every seasoning in your cabinet. And that way, then you can eat after surgery if everything tastes bland. And then the third thing is, sometimes there's also like a high end, I think, called the Spice Shop. If you want to do something a little bit, higher end, that has more natural flavorings. I have found, for instance, when I use better spices, that I get to use less of them.
Yeah.
So, when I use Redmond salt, Redmonds, and I've noticed that if I just get a pinch of that, which is about 60 milligrams, maybe a little 60 to 100 milligrams, that goes a really long way in my taste, in my flavor. So having, higher quality can help, I think, season your food as well.
Yeah. And I always think too, we're talking to an audience that is having a cosmetic procedure, right? You assume it's to look a little better, like making these improved choices in food shouldn't just be like this little window of time. It's a lifestyle.
Long,
Maintain your results. Yeah.
long term.
Yeah.
Long,
Yeah. Absolutely.
and the earlier you start, the better, because you can get swollen even after you're completely healed. I had Panda Express last week, and I love Panda, but it literally like 5 pounds of fluid, after my Panda Express. So
Yeah.
it's just a matter of, changing that taste. And it takes time. It really does. It takes a lot of time.
So let's see. You had said you had a question about painful knots, and was that about a wound thing or?
Oh, somebody I asked, I did a wound, I did a box as well, and I was like, ask any questions. It was actually about
Oh, gotcha.
it's about lipoburn, and we can talk about lipoburn too, um, like the nutrition behind a lipoburn. But she asked, I have pain. I've got knots. I'm 4 months post-op, and I have knots, and it's painful. Will I ever heal? And so,
I mean, there's so many questions. Like, that's such a like a yeah, you had surgery, but like what kind of what happened? Are you getting any post-op care? Are you wearing a garment? What are you doing? All that kind of stuff. So there would be lots of questions with that. So um,
A,
whoever that was can reach out if they want. Go ahead. I always take wound pictures if anyone is suffering with something, and if it's something I can help you with, we can always set up a consult. So,
yeah, I'll
um,
respond if she's on here or not. But I'll respond to her and I'll just say, send pictures to Heather and she can help you. You
uh,
want me to talk about lipo, foods for lipo,
lipo burn
foods
or
for lipo?
lipo in general. Yeah,
I was thinking
yeah.
I'm going to create a post about this because it actually would work out well. Um, okay, so well, do you have questions or you just want me to talk?
You can talk. We kind of, you already know what my questions were.
Um, okay, so for lipo burn, so it's different than a typical wound. It's different than just having an incision because you have impaired blood flow, you know. So then you may be dealing with dying skin or whatever. So from a nutrition point of view, um, I like to give a few options because like your recommendations will change with lipoburn. Um, and I'll give you some supplements and food options. Number one is with lipoburn, which is basically ischemia, right? Like that's really
Hmm.
addressing. Um, you want to make sure that you have oxygen, right? You have a good delivery of oxygen and you have nitric oxide. And those are the two things that are great to help you heal. So let's go back to oxygen. So that is when you want your chemo to be really healthy. You want plenty of iron rich foods for this. And so when I have a client come in, I had a client and she had a hemo of like 11.8, and I think the cutoff was 11.6. And she was like, oh, well, my surgeon said okay. That was great. And I said, yes, I know your surgeon said okay, and I highly respect your surgeon. I don't want it 11.8. I want it like 12.4. That's what I want. Because no matter what after surgery, you want to give yourself plenty of wiggle room when it comes to your hemoglobin. Because after surgery, did you lose blood, right? I mean, are they going to give you blood? Especially if you're going overseas, right? Like you don't know if they gave you blood or not. So you want a really good hemoglobin because you want as much oxygen as you possibly can to get to that wound. And you just want healthy blood, right? Because the
Right.
blood nutrients, it's going to give you all the nutrients to go to the wound. Okay. So that's the first thing. The second thing is when nitric oxide comes in. So oxide is is it's really well researched, but they don't really use not the term nitric oxide. But nitric oxide is really the delivery system. It helps the blood vessels relax and it helps nutrients flow to through the vessels. And there's actually strong research that backs that up with food and with supplements. And
Hmm.
one is arginine. That is like the number one, which is why I say, even if you don't like Juven, I don't care. You need Juven.
Yeah.
Is going to increase your nitric oxide cycles to get that delivery system to the wound. So that's why I recommend arginine. Now, arginine also has for food wise, I like food purposes of arginine are I like turkey is one of your bigger ones, pumpkin seeds, and then a precursor to arginine is called proline, and that comes in your eggs. So those are kind of the foods that I like to recommend because they're going to promote the arginine naturally, and they're going to provide that nitric oxide cycle. Also, beets are a really good one as well. However, I tell my clients you have to have it on only like, I don't want you taking pills. If you want it in a smoothie, that's great, but just, do like maybe 1 teaspoon a day because it can lower your blood pressure. So you just have to be careful with some of these nitric oxides because they can lower your blood pressure. So beets are a good one for nitric oxide. Pomegranates, there's a small study on pomegranates as well that can help with nitric oxide as well. So foods can help that whole cycle for the nitric oxide. So that's why I love, your high arginine foods, and then I also love Juven because those are the two big things that are going to help you with your wound healing.
How do you know, like, whole foods are best, it's great for you to consume. How do you know if you're getting enough from like food or if you need to supplement? I
That's a
mean,
that's a great. So what I do is I don't think about the amount in food. I just try to do my best with eating high arginine food. So I just try to make sure I'm eating 25 to 30 grams, of a protein at lunch, at breakfast, lunch, and dinner, whether it's your whether it's your turkey or your pumpkin seeds or whatever. So I don't really focus on how much arginine is in this turkey. I just focus on, okay, I need to have 25 to 30 grams, and I'm going to choose high arginine foods. But what I do is with the Juven, most of the research is between like 3 and 9 grams of arginine. And that's what Juven recommends. Actually, I think Juven even gives a little bit more arginine in it. I can't remember the label. I think it's like seven,
I don't
seven.
know.
Do you have it? It's like 7 grams each, or seven. Yeah, 7 grams. So I don't worry about exactly what's the breakdown in my food. I just make sure that I'm getting the nourishing food, and then my supplement is also providing like the actual amounts. If that
Can
makes
you overdo it with these things? Like, are they, some are going to be fat soluble, some are water solid, so are we worried about it? Are we
yeah.
can we have an issue by doing too much?
So what do you mean with the arginine?
I think more broad, like with all this stuff. Like I always feel like I've got people who are throwing everything at it, right? Like they're taking all the things.
Yeah, that's good.
Um, and they're like, I don't know, it's my wound's still not healing, or this isn't going well, or do we think maybe they're not getting enough if that's the case?
So sometimes it doesn't matter if you're not meeting your calorie and protein goals, it does not matter how much arginine you take. That's kind of the basis of
So,
it.
okay.
So that's why, like, I bring that up. You have got to meet these needs first before your body can use this. So, like, if you don't have enough of this, your body is going to use this to survive. It's not going to use this for the wound. So,
Yeah. Okay.
so
Great graphic. Take a snapshot of that.
I had to make up with my kids' crayons, right? I was like, but I was like, that's how, so I was like, how do I like explain, like you have to have this foundation, right? And if you don't have this foundation, I promise you, you cannot heal. I have seen it over and over and over again. I had a patient who, um, she had like all the supplements. I mean, like all the surgery supplements you can imagine, not healing, feeling horrible, not recovering, terrible because, right? She was doing
Not
this,
eating.
but she was not doing that. And your body, I had this great post, and I should probably quote it because it wasn't my original quote. I really should get where the quote is, but the quote is like your your skin is the largest organ, but it is the first organ that your body will sacrifice in order to survive. So
Mm.
if you are going through any trauma, your body is not thinking about healing that wound. If you don't nourish your body in surgery or any kind of trauma, it is not going to be the organs are not going to be thinking about sending any nutrients to that wound. They're only going to be thinking about survival. They're only going to be thinking about, how do I preserve blood? How do I preserve nutrition? Right. And so they're not going to be sending anything out. Right. And so that's kind of how we have to think about healing our wounds, is like, it does not matter if you're taking Juven 30 packs a day. You're not meeting that basic need. Your body, your body's not going to respond to that wound healing.
I
That's
feel the same way about, I mean, this is why I wanted to talk to you too, is like, there is no way that whatever I tell you to put on top of the wound, like you have to also have the body has to have the ability to heal. So we
right.
need like I could put the best thing on top of it, but if you're not feeding your body, if you're not moving your body and using it to circulate everything around, it's not going to work.
And that's how surgeons feel, right? Surgeons come to me and they tell me, I can do the perfect surgery and the incisions will completely fall apart if my client is not eating, if she was dieting before, if she was juicing and detoxing before. I could have the perfect surgery and it can fall apart. So that's kind of what
Yeah.
I think.
Yeah. So do you think that that's contributing to some of the issues, is that, sometimes they've got to like cut weight kind of to have the surgery, and maybe they were like dieting crazy
Yeah,
and then they went and had their surgery and maybe they weren't really like the healthiest shape to begin with,
right.
and then they tanked their systems, had the surgery, and came back
Right.
and now have wounds and issues and things.
And you probably have seen it too, that weight has no factor in nutritional status. So, you could
I'm a
be,
chubby girl, but I eat really well. I can't help it.
I mean, like that's hilarious, Heather. See, I knew that you were funny. I knew that you were. And I'm like, I knew this had a great personality. But like, whether they have a BMI of 30 or whether they have a BMI of 20, that doesn't represent nutritional status, right? It doesn't really represent that they're nourished or not. So oftentimes when I have a patient who has lost a ton of weight and then go into surgery, then number one, they are malnourished, right? They are malnourished. And then number two, then you tell them to eat tons of calories, they can't do it, right? Because
Yeah, the mental block, not gonna happen. Yeah.
mental, like, oh no, 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 I'm not going to regain. I'm not going to lose all my hard work. So, um, but at the same time, it breaks my heart because I know that women have gotten in those doctors' rooms and they've cried when the doctor said, I can't work on you until you lose weight. So it's like my heart breaks. It breaks so much
Yeah.
of that struggle, right? And and I'm trying to do something with that. Like I want to have like a um I want like a weight loss, coach to come to join me. Because I can't do it. Because I can't specialize in two things, but that's what I'm trying to do, is have like a weight loss coach come beside me and to help these girls, to lose it. Because oftentimes it's more of just, they just kind of need to meet that BMI. But I'm jibber jabbering, that's but
So there was one question. I know we think we might need to do a second live at some point to talk about feeding the fat.
oh my god,
But
a whole
yeah,
other that
someone asked a question,
we could
but
we'll have
we're not talking about feeding the fat with like fatty foods to maintain. Yeah, you got to do it the right way.
we could we could do a whole thing on that. But I also want to learn from you too, like any complications that you see from BBLs. That's what I want to get from you. So I'll have to host you, and then
We'll talk more about that because
yes,
that's a whole other, yeah, ball of
but
wax.
it's
Yeah.
yeah. And in fact, I was never talking about feed the fat. And the whole reason I did that whole thing is because I saw a doctor talk about it, and I was like, like, no. I was like, nobody's taking. I was like, I'm going to do this. And because I don't like to give a ton of information out. I mean, I don't like to give specific information.
Yeah, I was like, you give a ton of information all over your page is great.
Yeah, I just try to not to give specific information, you know. Um, but then with that, that's when I just started talking so much more about feed the fat, because I felt like if I don't do it, somebody else is going to do it and they're going to do it wrong. So once I started that segment, if anybody's watching and you're interested in that, you go back. I did like three, I think, and it's my three most popular videos I've ever done in nearly a year. And it's all about that. And ever since then, like I've grown so much faster since those three videos, just about because people just they're just so desperate for information, you know. So yeah, we'll definitely have to do it.
We'll talk more about that.
Yeah,
Um, well, I think we covered all of the questions I had.
I feel like there's
Right?
so. Oh my
I
God.
know. I mean, we could talk. There's a lot of people on. We thank you, thank you, thank you.
Yeah.
Um, let's see, something about Vaseline on your little spots. I'm assuming that's a wound thing. Vaseline's like the whole idea would be trying to keep a wound covered and moist, is the idea where the Vaseline comes in, but it's also a petroleum base, which isn't really the best for wound healing either. So you're kind of like clogging all the vessels. So it wouldn't be my recommendation. There's better things out there. I always take pictures and questions. You can message me directly. And Kylie, how do you like to be contacted?
Um, DMs is the best thing. And then if you apply for the Better Body, there's the link in my bio. Um, and that's the best way to.
So who are your favorite clients? Better, so you have to apply to be a client?
Yeah, just because there's some people that I just can't take. Um, and or sometimes the timing is not right, you know. So that's sort of
Hmm.
reasoning behind the applying is just, I mean, it's not like, oh, I don't like you. I mean, I basically said the majority of people, but I am it's more of like what time is, when is the timing of your surgery? Um, and then I'm trying to get into the VSG and the sleeves. But that takes, that's a learning curve and I want to do it right. So I haven't accepting VSG and sleeve patients yet, just because I want to do it right. So sometimes that's kind of what the application's for, is to kind of figure that out.
Yeah,
Uh,
make sure you're got the right person.
Question. So I was watching Dr. William on lipoburn, and he recommended the bacitracin. And so you say no, because you say it's old school. Is that considered wet to dry?
No, no, bacitracin's an ointment. So some people, Neosporin, bacitracin, those are like old old school stuff that's just like over the counter at this point. You probably everybody's got it in their um medicine cabinet or whatever. But it's probably fine for like your scrapes and cuts. But as far as lipo burn, it really depends on what stage we're at because it's going to be something that evolves over time. And you might see it at first and it's going to be dark and purple and black and blistery. It just depends.
Right.
And then sometimes it kind of sloughs off and it's not that bad. And then other times it's like, you're looking at the tip of the iceberg and it's way deeper. So it really just depends um, what we're looking at and how bad it is. So I've seen, um, I would like to have a procedure, but I'm scared because my DMs are full of wound complications. So
Knowledge is a curse, right?
yeah,
Knowledge.
yeah, yeah. I'm like, I'm not sure. I'm scared.
Yes. Yeah. I understand. Um, this sounds weird, but my battery's about to die. I charged.
It's okay. We talked longer than I thought. Um, yeah, so if you're not already following Kylie, get on her page. It's plastic surgery nutrition, right? Is that right?
Or nutrition.plastic surgery. Yeah.
Gotcha. And you have a free guide for the best proteins for cosmetic surgery. I saw that as a download. So anyone on here, get on there, get that going, and check out our page.
Yeah. And it's not just a generic one. It was, there's lots of proteins, but it's like, specific ones that I like. So it's a good resource.
Awesome. Thank you so much. I hope everybody enjoys this. Reach out to either one of us, and we'll see you next time.
Yes. Thank you, ladies. Thank you, Heather. I appreciate it.
Yep. Thank you so much.
Hey, I want you to check out the conversation that I had with Kylie Amanda. She's a registered dietitian. We talked about how important it is for you to be taking in the right foods for healing after your cosmetic procedure, your plastic surgery, to help avoid issues like lipoburn and open incisions. We talked about different ways to supplement. Please check out the conversation. Drop your comments and questions below. And make sure that you give Kylie a follow over on Instagram. She's nutrition.plasticsurgery on IG. And she's got a free guide to the best proteins to be taking for your cosmetic surgery procedure. Go ahead and reach out to her. She does some consulting work for pre-op and post-op, especially if you're having a complication or you're worried about it. And if you're having any wound issues, please reach out to me directly. You can drop me a picture or comment or whatever below, or reach out at betterwounds.com. Thanks.